Physical activity brings a lot of health benefits for people, but on this week's edition of Today's Health, we learned that those benefits could come at a price. Jennifer Lenzini reports.
Breaks, tears, and strains are common in physical contact sports, but they also can happen in your typical day-to-day physical activities. Wellness specialist Natalie Orodami-Hughes says that one of the most important things you can do before you start any type of exercise is making sure your body is prepared.
The worst thing you can do for your body is to just jump out there and get into action without really stretching the muscles first.
That stretching should be anywhere from 5 to 10 minutes or whenever your body is ready to go. In the case that you do have severe pain, swelling, or numbness from any injury, it's important to follow the RICE method. Rest, give the injured area time to heal. Ice, apply an ice pack for about 20 minutes at a time. Compression, wrap the area with an elastic bandage. And elevation, if possible, keep the injured area above the level of your heart. It's crucial to follow the RICE method to prevent reoccurring injuries in the same location.
If you don't kind of go through that regimen of what you should do to take care of an injury, then yeah, you're going to be more likely to hurt something again because it wasn't necessarily healed.
In other health news this morning, deaths among people who misuse heroin and prescription painkillers have increased dramatically over the past 2 decades, but improving medical care for these patients could reduce the number of addiction-related deaths. Researchers followed over 32,000 patients treated in the Veterans Affairs healthcare system for opioid abuse. They found deaths were much lower among people who were not prescribed anxiety medications, those who got counseling, and patients who saw a doctor regularly. A new study reveals the best ways to avoid mistakes when measuring liquid medications for children. More than 80% of parents made at least one error when measuring 3 amounts of medicine using a dosing cup or syringe. Parents who used tools closest in size to the prescribed dose made the fewest mistakes. Picture instructions also cut down on the number of errors. That's it for this week's edition of Today's Health, and coming up on KPVI News Today, we take a look at your KPVI News Today headlines.